Hello everyone, today I am going to start our FMGE January 23 recall of community medicine. So, this is actually a recall based paper. So, there may be not the exact language of the question is may not be same, or the options may not be there, or may be there, or may not be correct, but you can understand the topic very well here, because I have tried in the explanation that I have covered all the aspects of the questions. So that those who have attempted the question, or those who are going to attempt in the next exam, they can able to understand what type of topic is asked in the exam and what should be the answer of this question. Okay. So, let us start from the first question, that is per capita space in school should be. So, the healthy school environment is very important topic. Okay. Healthful school environment is important topic, and you should know the criteria of the healthful school environment. Here the criteria, the location should be away from the noisy surroundings, okay, and it should be fenced. 5 acres of the primary school, this is the area, minimum area for the primary school, and 10 acres for the elementary schools. And exterior walls should be 10-inch thick and should be heat resistant, so that internal temperature is maintained. And 40 students, maximum student 40 students per classroom should be there, okay, not more than 40 students per class. And per capita space, that is our question, it is already asked in other examinations, 10 square feet. And the desk should be managed type of desk. What is managed type of desk? Where your spine should be straight, okay, means your writing pad should be like that your hand should be, spine should be straight, okay. If this writing pad is very much lower, so your spine would be like that, or if it is higher, then your spine should be like that. So, your spine should be straight, so that this managed type of desk is used, okay. Doors and windows should be more than 25% of the floor area. Combined area of the doors and windows should be more than 25% of the total floor area, okay. For example, if there is floor area is 100 square feet, so 25 square feet should be the door and window, okay. Inside color of wall should be white color, okay, so that proper lighting is attained, because this white surface is good reflection is there, okay. And lighting, natural light from the left side should be there, okay, from the left side the natural light should come. And water supply should be safe and potable water supply, and it should be continuous, okay, through the taps. Urinal should be for the per 60 student, and the latrine should be per 100 students, okay. So, this is the actual healthful school environment that is required. So, coming on the question, the per capita space school space in school means per capita space per student means 10 square feet, okay. That was our question, okay, that was our question. Next question is flag signs of flaky pain dermatosis is seen. So, flag sign and flaky pain dermatosis is actually a kind of a malnutrition related disease, and many options were there. One option was kwashiorkor and another was marasmus. People often get confused between these. So, how we can differentiate between kwashiorkor and marasmus? I have tried to cover this topic. So, you can see this child is kwashiorkor, okay, and this is the marasmic child. Marasmus means we learn in our undergraduate, like marasmus means marasamach, means it is very characteristic type of child, and you can see his ribs here, okay, and here the child is looking not very characteristic, but edematous kind of child. And people often get confused that my child is not thin and that he is healthy, but he is somewhat sluggish, but this is the actual dangerous thing, okay, because here liver impairment is there, okay, so that the edema is there and people miss the malnutrition here, okay. So, growth failure is present in both and wasting is present in both, but it is more marked in the marasmus, because here wasting is covered by the edema, Okay. Edema is present, sometimes it is mild, but it is present always. Okay. And in the marasmus, edema is usually absent. There is a spectrum of disease called marasmic kwashiorkor. Okay. It is marasmic kwashiorkor. Okay. Marasmic kwashiorkor is there. So that is the kwashiorkor and marasmus, both of the feature are overlapped. Okay. There may be both of the features in one child. Okay. Mental changes are there. They are very common in the kwashiorkor. It is uncommon in the marasmus. In the dermatosis or flaky pain dermatosis is common in the kwashiorkor. Okay. In the kwashiorkor, there is a skin is peeled off like a paint. Okay. Skin changes are there. So this is called flaky pain dermatosis. Okay. Appetite is poor because here liver impairment is there, so all the features of the liver impairment should be seen here. Appetite is poor here, but here liver impairment was not there. Appetite is good here. The prognosis is good here. If the child start taking calories, so it becomes healthy again. Here serum albumin is also decreased in the kwashiorkor. In the anemia, it is severe sometimes, and subcutaneous fat is reduced, but it is present, and here it is subcutaneous fat is absent. You can see that. Okay, face is edematous, it is monkey like faces are there. Okay, and fatty infiltration of liver is present, as I already told that liver impairment is there in the kwashiorkor. Okay. So flaky pain and flag sign is seen in the kwashiorkor. Flaky pain dermatosis is a different thing. What is flag sign? Flag sign is actually a hair change. Okay, hair changes are there in the flag sign because there is a period of nutrition there where the hair is black, and period of malnutrition is there where the hair is grey. So alternate there is a period of nutrition and undernutrition. So there is a grey hair and black hair in the patches. This is called flag sign. Okay. And flaky pain dermatosis is the skin. Okay. It is in the hair. Okay. Coming over next question, the another question was on the case control study. What are the disadvantages? Okay. So I have tried to teach you the case control study and the cohort study in the detail. Okay. Here you can see that cohort studies are actually forward looking studies, and case control studies are the backward looking studies. It's called retrospective studies. Okay. It's called prospective studies. Here in the case control studies, disease have already been occurred. Okay. Disease have already been occurred. Okay. Or here disease is not occurred. Okay. Only exposure is there. Okay. So here exposed and non-exposed group are there, or here diseased and non-diseased group are there. Okay. Okay. So it is effect to cause study, it is cause to effect study, it is exposure to outcome study, it risk factor to disease study, disease to risk factor study. It is just reverse of that cohort study. Okay. So here it is a follow-up study, so you can calculate the incidence. Here incidence cannot be calculated. Okay. Incidence cannot be calculated. So in the formula of relative risk, incidence is there. So relative risk is not calculated in the case control study. Okay. Here relative risk, attributable risk, population attributable risk, these all can be calculated in the cohort study. In the case control studies, only odds ratio can be calculated. Okay. Minimal no risk to subjects are there because disease has already been occurred. Here ethical problems are there because you are not doing anything. If you are following any group and you are seeing that they are smoking and you are not stopping them from smoking, so there is some ethical problems are there. Here loss to follow up is also there. Some patients are you are following and they are missed, some may be died, some may be migrated. Okay, it is very time consuming process. For 20 to 30 years some studies have taken, from Framingham studies had conducted, the cohort study has 30 years. Okay, so it is very expensive because here you have to follow the group from the long period, so there is so much expenses are there. So it is not suitable for the rare diseases. The rare diseases may not be any symptom, any cases should not be there. Okay, you have followed the group for 10 years and there not should be a single case. So your study and 10 years will be wasted. Here this can be case control study can be there for the rare studies. Okay. So as you see in the question, odds ratio is advantage of case control, not disadvantage. It is a rare disease, it is the advantage because case control study is done in the rare disease. Recall bias is a disadvantages. Okay, this is the answer. Okay, loss to follow up is in the cohort study, not in the case control study. Okay, so recall bias is there because why recall bias? Because what is recall bias? Recall bias is actually when you ask the question to the patient and patient is unable to recall, or he is not for example, cases are able to recall something very clearly and controls are sometimes miss the incidents. Okay, so in that manner cases give the better history and the control doesn't give very good history. So that means there may be a recall bias there. Okay, so it is a problem of the case control study. Okay, so there are many biases are in the case control study, and one of them is the recall bias. Okay, this is a disadvantage of the this study. Okay, you can say that here is a recall bias. I am going to add in that is a recall bias. Okay, maximum allowable attrition rate in the cohort study is 5%. You can loss to follow up should not be, for example, 100 cases. If you are 100 person are following, you are following 100 patients, not patients, actually 100 persons, because you are seeing exposure group. Okay, exposure and non-exposure group. So you are following 100 exposure and 100 non-exposure groups. So only 5% should be lost. 95 you have to follow. Okay, cohort study is always better because it carries means direct supervision, not on the memory. So you can find the incidence and as well as relative risk, attributable risk as well, which is very good estimate of risk than the odds ratio. Another is a very important question. It was a repeat question from the last year. Niacin deficiency 3Ds, that is diarrhea, dementia and dermatitis. Okay, nutrition is a very important topic of the FMGE exam. So many questions were from the nutrition. So I have tried to incorporate some nutrition fact in the lecture. So diarrhea, dementia, dermatitis is a niacin deficiency. What is niacin deficiency? Niacin deficiency is actually a vitamin B3. B3 is a niacin. Okay, the 3Ds are diarrhea, dermatitis and dementia, and 4 is the death. If it is 5D, then delirium is also there, and if there is 6D, there is depression is also there. What is dermatitis? In what manner dermatitis is seen is a casus necklace appearance. Sometimes this diagram is given and it has been asked what is this. This is the dermatitis of the neck region. It is called casus necklace appearance. Okay, casus necklace appearance. Confidentiality is maintained. We all know that in the HIV infected persons there is a counseling session is there. Okay, ICTC centers are there, integrated counseling and testing centers. So here is counseling in the HIV, and here it is confidentiality is maintained in the counseling. So there are what is counseling? We can know what is counseling is. Counseling, it is also used in the contraception as well. In the contraception, a gather approach is used. It's called cafeteria approach in the earlier. So gather approach is the G for greet, means you have to greet the patient or your person who are coming for you for the counseling. You have to greet them and ask what they require and tell the options to them and help them to find the right option and explain all the effect and side effect of this anything which you are counseled. Okay, then ask when to return to follow up. Okay, so this is the gather approach. It is usually followed in the counseling. Okay, so the confidentiality is usually maintained in the counseling. Which fatty acid good for cardiovascular system? That is omega 3 fatty acid. We all know that omega 3 in TV ads we can see that omega 3 rich oil is there. Okay, so there are many kind of oils. and fatty acid which are important to us. For example, linoleic acid is the richest in the safflower oil, it is the best oil. The most unsaturated oil is safflower oil. Unsaturation is good thing. Okay. Safflower, then sunflower, then soya bean, then corn oil. This is the order of unsaturation. Here highest unsaturation is there, and in the groundnut is the groundnut, then lower side, then below the groundnut there is a coconut oil. Okay. Coconut oil is not very healthy because we often seen that in the winters coconut oil freezes, okay, like a ghee. Okay, so it is very saturated type of oil, unsaturation is less here. And linolenic acid is highest in the flax seeds, arachidonic acid is highest in the safflower oil, eicosapentaenoic acid highest in the fish oil, docahexanoic acid, docahexanoic acid, it is highest in the, actually it is the component of the breast milk, found in the breast milk. This amino acid is fatty acids found in the breast milk. It is good for the brain development. Okay, for the development of the child, brain development of the child, it is important, DHA. Okay, monounsaturated fatty acid, oleic acid, it is not essential, it is richest in the olive oil. Okay, saturated fatty acid highest in the groundnut oil, and omega 3 alpha linolenic and eicosapentaenoic acid, docahexanoic acid, they all are the omega 3 fatty acid. Okay, this was our question, and this reduces the cardiovascular diseases. Okay, I have already taken this in the FMGE exam series recall session in the previous question. These slides I have already told. Okay, omega 6 linoleic, arachidonic acid, gamma linoleic acid, gamma linoleic acid is the omega 6, and omega 3 omega 6 ratio should be 1:1:1:4, and omega 9 and monounsaturated fatty acid, oleic is a kind of oleic acid, and it is non-essential. Okay, this all about the fatty acids. Another very important question was regarding vitamin A. What is the dose of vitamin A in the 8-month-old baby? Okay, so there may be option of 550,000, 1 lakh, 2 lakhs or 3 lakhs. Okay, so you have to learn what is vitamin A deficiency cause, what is the disease caused by the vitamin A deficiency, that is xerophthalmia. It is the first sign is conjunctival xerosis, and first symptom is the night blindness. Okay, most specific manifestation is the bitoid spot, and when the bitoid spot is more than 0.5% of the population, it is called as a vitamin A deficiency, is called a public health problem. Or night blindness, it is more than 1%, it is a kind of a public health problem. Okay, in the treatment of the vitamin A deficiency, we usually give 0, 1, 14 days, 1 lakh international in the less 1 year, and 0, 1, 14 2 lakh international in the more than 1 year. Okay, so in the 8-month-old of child, the dose of the vitamin A should be, it is less than 1 year, so it should be 1 lakh, and below 6 months, it should be 50,000. Okay, if vitamin A, if at all, is given in the less than 6-month child, it should be 50,000 international units. Okay, between 6 to 9 months, it is 6 to 12 months, it is 1 lakh. So in the 8 month or 9 month, it is usually 1 lakh, and in the more than 1 year, it is usually 2 lakh international units. Okay, in the prophylaxis program, one vitamin A prophylaxis program is running, where in the 9 month with the measles rubella immunization, you will give vitamin A 1 lakh international units oral. Okay, and after every 6 months, we give 2 lakh, and total 17 lakh international unit dose will be given, 8 doses after 1 year and 1 dose before 1 year. Okay, 1 lakh international equals to 30 milligram of this vitamin A, and intramuscular dose should be half of the oral dose. WHO classification was X1A, X1B, X2, X3, X3B. X3B is a keratomalacia, and X1B is a bitoid spot. Okay, Okay, this is night blindness, this is fundal changes or sclerosis. Okay, so this is the classification of WHO vitamin deficiency. What is the shelf life of copper T 380A? No, copper T is very important, means overall contraception is very important part. So I have taken some copper IUDs here, intrauterine devices, where first generation devices was oldest, that is non-medicated lipase loop. Second generation device is the bioactive intermediate device, that is copper T 380A, copper T 220B, multi-load. Okay, so some have availability of more than 3 year, more than 1 year, more than 2 year, but these 380As can be in place in the up to 10 years. So longest is here. Okay, third generation is medicated by progesterone. For LNG, iodine, marina, this can be implanted for 1 year. Okay, so this is about the first, second, third generation IUDs. What is the mechanism of action of the IUDs? Sometimes it has been asked in the question. Foreign body reaction is the main mechanism. It reduces the viability of gametes. The other is for copper containing IUDs. Copper alters the enzyme cellular mucus effect and affects some sperm motility, and survival and capacitation of sperm is impaired. And hormones increase the viscosity of the mucus in the third generation progesterone devices, and prevent the sperm entry and implantation. Okay. Post-dated pregnancy or post-term pregnancy. Okay, the post-term pregnancy has been asked. It was very easy question. Okay, post-term pregnancy, it is usually more than 42 weeks. Okay, so preterm is before 37 week, 37 to 38 weeks. Sometimes it is called as early term. Okay, this 37 to 38 week called early term. Some books in 38 more than 30 weeks called term. Okay, and 37 to 38 is called early term, but 37 to 42 is a term, 42 is post term, and less than 37 is preterm. So how we calculate the EDD? Add 9 months plus 7 days to the LMP. What is LMP? LMP is the first day of the last menstrual period. That is, first day of the last menstrual period means first day of the bleeding is the first day of the cycle. So last menstrual period, first day of the bleeding is called LMP. Then we add 9 months and plus 7 days. Okay. So average birth weight in India is usually 2.7 to 2.9 kg. Low birth weight is called less than 2.5 kg. Body weight, if the child is less than 2.5 kg, it is called low birth weight, irrespective of the gestation level. Whether the child is born in 8 months or 9 months or 7 months, if he or she is less than 2.5 kg, it is called low birth weight. The WHO classification, low birth weight is less than 2.5, moderate low birth weight is less than 2 kg, very low birth weight is less than 1.5 kg, and extremely low birth weight is less than 1 kg. Okay. What is small for gestational age, which is usually used for the term pregnancies and the post-term birth when the weight is less than 10 percentile of the gestational age. And most common cause is the IUGR. What is IUGR? Intrauterine growth retardation. Okay. Maternity leave under ESI Act. We all know that in the ESI Act, maternity leave is 26 weeks. So I have tried to cover the benefit under the ESI Act in this chapter. Okay. What is the medical benefit? Is a full medical care to his beneficiaries. Okay. And sickness benefit is more than 70% of the average daily wages and is payable for 91 days in any continuous period of 365 days. Okay. Extended sickness benefits payable for 2 years. A set of 34 days are included in this, and 80% of wages is given. Enhanced sickness benefit, it is full average daily wage for duration up to 7 days in case of vasectomy and 14 days in case of a tubectomy. For tubectomy 14 days is given, okay, and vasectomy 7 days. Maternity benefit, full average daily wage duration of 26 weeks. This was our question, okay, new guidelines, and 5,000 per confinement, okay, 5,000 rupees is given per confinement, and daily wages or duration of 26 weeks is given, okay. Temporary disablement benefit is 90% of the average daily wage till recovery, and permanent is 90% of the wages for the law of earning by a medical board. Medical board is set up and they estimate the cost of that loss of earnings, okay. Dependent benefit, pension at the rate of 90% of wages, and funeral expenses not exceeding 10,000 rupees. Okay, this new amendment rules in 2017, that is, insured woman is a commissioning mother who is biological mother to have a child and prefers to get embryo implanted in the any other woman. First, in the case of surrogacy, this is commissioning mother is called as a biological mother, okay. In the case of surrogacy, a woman who was a legally adopted child up to 3 months of age, it is also an insured woman, okay. Maternity benefit for insured woman non enhanced to 26 weeks, 6 months for the full confinement, okay. Insured women of 2 or more than 2 surviving child, maternity benefit can be given here up to the 12 weeks. In the 12 weeks, not more than 6 weeks should precede the expected date of confinement. In the means if he is going to deliver the child, so not he should be given 6 weeks after the delivery and 6 weeks before the delivery, okay. Safe approach. There was that confusion what the safe approach is asked, or the prevention strategy in the safe approach is asked, okay. So safe approach is usually followed in the trachoma. We all know that in the trachoma, safe studies by the WHO. As for surgery for the trichiasis and entropion is a tertiary kind of prevention. Trichiasis and entropion is a complication of the trachoma infection by the Chlamydia trachomatis, okay. Antibiotic use is a secondary kind of prevention. Facial cleanliness is the primary prevention, okay, to clean the face, and the environmental improvement is a kind of a primordial prevention, so that no risk factor is developed here, okay. Levels of prevention is very important topic, because every time one question regarding this can be asked. So you have to know that what is the primordial thing. Primordial is when there is no risk factors are there and no disease is there, okay. In the primary, risk factor is there but no disease is there. In the secondary, disease is already been started and you are doing early diagnosis and treatment, okay. In the tertiary, disease has been fully blown, disease are there and you are doing some due to reduced the disabilities, okay. So disability limitation and rehabilitation, okay. Okay, this is the level of preventions, okay. In the primary, oftenly specific protection word is used, specific protection is used like immunization and chemoprophylaxis, and in the primordial usually health education and promotion is used, okay. Health education, health promotion is also used in primary, where there is a risk factor is there and you are promoting health, so it is kind of primary, and if there is no risk factor, then it is called primordial. Dental fluorosis, question has been asked. So in the dental fluorosis, endemic fluorosis, it is due to the increased fluoride content in the drinking water. Fluoride is called the double-edged sword, okay. Where there is a less fluoride, okay, there may be dental caries, and where the increased fluoride, it is they cause dental fluorosis or skeletal fluorosis, okay. So usually on the Andhra Pradesh, it is very often because there is a sorghum eating is there and the sorghum helps in the fluoride retention. Optimum level is 0.5 to 0.8 level, okay, should be found in the water, it is good level. If it is more than 1.5, called dental fluorosis, is more than 36 is called skeletal fluorosis, and if it is more than 10, then this can call crippling diseases, okay. very severe form of skeletal fluorosis there. Nalgonda technique is used to defluoridation of the water. In this technique, lab is used for lime, then alumina A, it is the most important part, alumina, and B is for bleaching powder. This thing is used in the Nalgonda technique. Okay. You can see here, this is a yellowish discoloration or whitish patches are there, dental fluorosis. This is also part of a fluorosis, genuvalgum. Okay. Knees are touching and ankles are apart, it is called genuvalgum. It is also kind of skeletal fluorosis. Okay. So, that is all about our class today. So, I suggest you to subscribe to our app, YouTube channel, Facebook channel and Instagram of the Global Academy of Medical Education, so that you can keep updating yourself regarding the medical education. We are doing T&D classes for the NEET PG as well. So, you can enhance our knowledge in the last few hours of the exam. Okay. So, that is all for today. Good day.